I just want to ask a sort of question to our panelists, really, just a point. You know, we've talked about quite a lot of innovative work. Jenny, you talked about sort of getting sort of 44,000 leaflets sort of printed off and then volunteers to distribute them. And what we hear a lot of, we need more money, we need more money, we need more money. You know, is this all about funding to get these things going, or is this more around harnessing the energy of what's already out there? What is the balance between funding and the natural resources and the willingness of people to help? How do we get that balance right? Is it about just chucking money about?
I mean, it's about that program, sort of growing organically in what's right in a particular community, but also being able to have the funding to know for a period of time that you can do that work. So to have that security of 5 years funding and the trust that actually we'll leave you alone, you know, do what's right for your community, because we've got to walk the walk. If we're saying to communities, hey, use the power of communities, we trust you, trust yourselves, trust each other. It's about being trusted as organizations as well as part of that sort of infrastructure, to just that sort of people up above are trusting us to do the right thing, and will invest in that. You know, there isn't some sort of didactic thing of saying this is what you've got to do, but funding it with the freedom to do what's right for each area. Our funding is very small, but I don't necessarily think it's about harnessing or anything, because that's kind of like feels like it's taking ownership of it, or saying it's more about just recognizing and shining a light on the power of all of us to do anything without professionalizing it. And just that permission that we give ourselves and we give communities to just get on and do what we all see as right.
Well, I think as well that the work we've been presenting to here is actually examples of the preliminary work for pushing this agenda. We need some research and we need some ways of measurements to do this. But next to that, I really like the notion of collective efficacy, both from a scientific point of view, but also from a human point of view. And I posed a question in the chat whether Anne and Liz are seeing a link to the notion of collective knowledge, because I see it as part of the same page that we need to push the experience and the experience of all of us, that together we can achieve more than as individuals. And I guess this is sort of a very important message. And the reason why I asked about the link between collective knowledge and collective efficacy is that I've seen some tests in Denmark where you ask people to estimate the age of other people. And if you have one person estimating the age of other people, we go wrong. But if you have 100 people estimate the age of another person and we take the average, they're almost always right. So the idea that bringing together human brains working together and creating solutions is a quite powerful thing. But talking about these things, you risk sounding like a hippie from the 70s. So we need the research as well to support these everyday feelings that it's actually quite important for us to be together with other people in our lives.
Can I relay a couple of questions that have come to us?
Yes, please, David.
There's a comment as well from Vicky Sullivan about her interest in collective efficacy. And she's mentioning Maori families, which is certainly very intriguing. It being tried in the other side of the world, where of course we know they're doing some very clever things. The first question particularly was from Nicola Haslam, who's asking, are the connectors paid employees or volunteers? And she also then goes on, I think, to say, does community empowerment mean that in general, more time in the community leads to healthier lives?
Jenny?
The connectors are not volunteers, and that's when we've had people coming to visit us from other areas and learn about our work. It's that real thing of, I call it the outer skin of the onion. It's just all of us. Those connectors are you, me, sixth form student, hairdresser, taxi driver, anyone is a connector. So it's just empowering us with knowledge. Interestingly, Vicky, who's on this conference now, we shared that Community Connector sort of training with her, and she's now trained up loads of people in the area that she works in. So it's it's such a simple thing. It's very replicable, and it's like Dementia Friends. If anyone's done a Dementia Friend training, you're not a volunteer, just an empowered citizen.
I think that's quite an interesting distinction, don't we? Because we think of volunteers and volunteer agreements and everything which goes with it. But from what you're saying, the connectors are very much just people who've just attended a short training, who are out there doing their everyday lives. And if they come across someone who might benefit from a bit of information, then they start up a conversation.
It's that simple. It's not, I mean, none of this stuff is rocket science. None of it is difficult. It's all really simple and easy to implement.
What about the other half of the question about, does community empowerment mean that in general more time in the community leads to healthier lives?
I think the evidence clearly shows that, David, and I know some of the data you've got through medical practice has shown an impact on things like health service use and that side of it. But definitely, I think there's a clear evidential link between the two now. Nikolai.
Yeah, and in Denmark we sort of had this funny paradox, you could say, that it seems from science that it's more, I mean, going home from work, going home being lonely is less healthy than going to the bar and drink a beer and smoke a cigarette. So not trying to emphasize that you should all start smoking and drinking, but just to say that loneliness is a killer. So in that perspective, the answer to the question whether being part of an empowered community where we care for each other and we signpost each other is a healthy activity, I would definitely say yes, both from a human perspective, but also from a research perspective. Togetherness and citizenship are quite strong, healthy drivers. My point also around the collectiveness, and yeah, so I would say that there's clear evidence that an empowered community where we care for each other and look out for each other's well-being is a healthy a community that will drive towards a more healthy level for all people included.
One sort of question then for both of you really is, you both talked about talking cafes and football groups and all the rest of it, all the things which involve a certain amount of proximity. So how do you see, particularly as we potentially go into winter with social distancing still in force, how do you see some of this being transferred into other mediums? How can you sort of keep that sort of ability just to drop in somewhere when, you know, our cafes and things are potentially going to be closed, or when you can't sit near someone? And
we've seen a lot of when we've had the sort of decrease in the groups and people going to the groups, and the increase in that sort of those networks that have popped up in the community. So we're being curious about those networks that have popped up that are sort of, you know, that might help each other and do the shopping for each other and things like that. Is that taking the place of the groups, and how can that then actually help those community groups and things that might need support in being set up again? How can maybe these networks sort of work together with that? Because it is that kind of, those people have been really busy, and those street networks and things have grown because of COVID. Are they going to disappear? Or, you know, I don't know. I'm interested in that increase of that and the decrease in the groups, and what's going to happen next. So there's no answer there, but just curiosity.
In research that we're doing at the moment, using Genie as an intervention and looking at loneliness, a lot of our research obviously has been halted through lockdown, but we have been working with a number, 20 plus different community organisations who we've been able to stay in contact with via phone and Zoom meetings. And feedback from those community organisations is that they've nearly all found a way to keep in contact with their people, with their volunteers, or with their the people that they're helping, and they've sort of reverted back to regular phone contact and writing letters. They've sort of created almost like pen pal relationships between people in the group, and created many more newsletters going out. So I think going back to writing and phone calls has been their way forward. But yes, we're curious to see how that will be sustained in the long term. But the lack of the physical groups and activities has meant that people have had to find other ways, and thankfully not all through WhatsApp groups.
Yes. Nikolai.
Well, in Denmark, we also, the Prime Minister, I think, introduced this notion of hunger for skin contact. And during the COVID-19 crisis, the first month or the first 1.5 months, I was really accelerated with the possibility on digital contact, especially with my colleagues, but also with friends. At the same time, in Denmark, we had to shift from physical face-to-face groups in our peer-to-peer online to peer-to-peer online groups, and we sort of managed to take over the groups for more than 40 municipalities and making them online. And we had a lot of people attending. Up to 400 people have been in a group from Easter until now in Denmark, which is in our setting is quite amazing. But looking and listening to the participants in those groups, the focus have always been the skin contact or the physical contact, being close to other people. And if I look at my own process through the crisis, I developed my own notion of the hunger for colleague skin contact. Don't misunderstand me, but the first month, everything actually worked quite well. We used Teams, we used Skype, and got the work done. And we actually also met for social meetings instead of taking a beer together Friday afternoon. But still, there was something missing. And listening to the peer-to-peer groups online, it seemed that the whole conversation was still about getting back into real life. And the municipalities experienced that our online activities actually work quite well, but they also work as an onboarding to real physical contact. So they have waiting lists for physical groups when they're allowed to do that again. And in Denmark, we're a little bit ahead of UK, so we're actually seeing group activity again, of course, with social distance and stuff like that. But in Denmark as well, we see some pretty disturbing numbers, a steep reduction of people going to the doctor with mental problems, a steep reduction of people going to the doctors with symptoms for cancer and other severe health problems. So I think that we will see some massive problems in the next half-year time where we can start seeing what happens when we are isolated and we are alone for both the physical diseases, but also the mental well-being. So not trying to downsize the digital possibilities, they're great, but I would say they're great supplements and support for real contacts.
I was just thinking about those networks that have sprung up. Like in Frome, there is a sort of a different group, which is cyclists who have all got together to do a Frome Towns of bicycle delivery system. So that is in a way a different group of people who aren't getting around meeting at a certain time on a certain day, but are getting around a shared interest of cycling, but also a shared need that they've perceived in the community of how do we deliver these things. And those were the postcards that we've got, which we're giving to community groups, so they're sending them out to their members, and young people are delivering them to older people. So yeah, I think there are those as I say, there's different groups that are forming, doing different things. Whereas in the past they might have been meeting physically, or maybe these completely different groups with different ideas are popping up. So interesting times.
Okay. Well, we're up to time. So I just want to say a huge thank you to Nikolai and Liz and Anne and Jenny. We will be doing further webinars on the whole sort of topic of empowerment. We'll be looking at core tools and skills for health and care professionals to use in the day-to-day work. We'll be looking at the whole area of how do you implement these approaches and how do you look at quality improvement around these approaches. We'll be looking at a bit of a deep dive into a couple of case studies as well and other topics as well. All of this information will be available on the CEmPaC website. And I wish everyone well and stay safe, wash hands and keep your distance.
Thank you, Jim.
Thank you.